It can increase your blood pressure, and it can lead to erectile dysfunction. That is your body trying to tell you you're in imbalance. You have dysbiosis. You probably have periodontal disease. Periodontal pathogens are linked to Alzheimer's, dementia, fertility issues, cancer, mood disorders, autoimmune issues. I mean, the list goes on and on.
What's your feelings about mouthwashes? I know it disrupts the balance in your mouth. So what's your feeling about that?
Social media, if we're going there for information, can be so black and white. And there's so much nuance to these conversations. I'm not opposed to all mouthwash. Mouthwash just means rinsing something in your mouth. So I like water. I like water with baking soda, ozone water.
Yeah.
You know, there are things I support. The mouthwash we're speaking of, though, is conventional, the big brand mouthwash that is made with alcohols and astringents and dyes and artificial flavors. And there are many studies now that are showing that it will wipe out the commensal healthy bacteria, particularly on the dorsum or the surface of your tongue.
Right.
And that's responsible for the nitrate reduction process, which leads to nitric oxide production. And this is important for cardiovascular health, immune health, sexual health. And so the studies show people who use it regularly, which most people who use this, they'll use it multiple times a day.
Right.
It can increase your blood pressure, and it can lead to erectile dysfunction and even potentially cancer. You know, you're putting something pretty caustic into the mouth. Let's say you do this 2 or 3 times a day for 2 decades. What is that doing to the cells of your tissue, your oral mucosa? And so I mentioned this in my talk earlier. If you feel you need to grab these really strong burning mouthwashes to feel clean or to help with odor, you have something else going on. That is your body trying to tell you you're in imbalance. You have dysbiosis. You probably have periodontal disease. Periodontal pathogens are linked to Alzheimer's, dementia, fertility issues, cancer, mood disorders, autoimmune issues. I mean, the list goes on and on. So you don't want to ignore this. And there are things and strategies we can do, including using red light to help balance the ecosystem and create more diversity and less pathogenic bacteria.
Wow. I'm going to switch gears.
Yes.
Tell me what your thoughts are about amalgams and also about root canals.
Okay. Amalgam was banned in the EU earlier this year. I hope the United States follows suit. So amalgam are the silver fillings that people have placed. There is mercury in them. And there are studies to show that when we chew, we drink hot liquids, we clench, we grind, some amount of mercury is released. And so what is this doing to the body as it accumulates over time? And if you haven't done heavy metal testing, I suggest you do, especially if you have mercury fillings. Maybe you're fine, but maybe you're not. So I don't like to create panic. I don't want everyone, I think mental health and anxiety is the most important thing. That's really important in my messaging. I just like people to be aware. And certainly if you have a mercury filling, an amalgam filling that's failing and it needs to be replaced, please don't replace it with another amalgam mercury filling. Use a bioceramic or maybe an inlay or an onlay. But I would like people testing if you have a lot of these materials in your body, because they could be part of the reason you're having health issues.
Yeah, I'm part of kind of an interesting club of integrated functional health practitioners. And on the oncology side, many of these oncologists won't even treat the patient unless they get their dental profile in check.
I was part of that in residency with the pediatrics.
Wow.
You have to have solid oral health before you start your chemotherapy or radiation. It's the same before you go in for cardiac surgery. I mean, all surgeries because of bacteremia, and it can lead to a slew of infection and issues down the road. So we need the patient stable.
So now let's shift into the root canal.
I'm going to add one thing to this. This is really important. The host, your health is very critical prior to the removal of your amalgams. So if you're very sick, if you have autoimmune disease, if you have Lyme, you're just unwell and you don't know why, sometimes it can make things worse. To have your mercury amalgams removed without working the patient up, stabilizing them, optimizing them as best as possible, and then having a detoxification protocol after.
Right.
Very important. And certainly red light is involved in that as well after the fact. But I encourage you not just to go in to any dentist and have them all taken out. You may feel really ill after because you've exposed yourself to all of this mercury. And there is something called the SMART protocol. It's the safe mercury amalgam removal technique. And so you want to look for a SMART certified provider, and they will help guide you along the process.
How smart is that, right? Do you do root canals in your practice? Or if I had a root canal, would you recommend for me to maybe have that tooth removed?
Yeah, this is a nuanced conversation. It's very much a scholarly debate among myself and colleagues. I like to start first and foremost with the mental health aspect that I spoke about earlier. So if I'm to say every root canal is toxic and everyone on this planet needs every root canal out, I don't think that's serving a beneficial purpose to the population.
Right.
Okay. I think it is case dependent. I will say I believe most root canals are done improperly. So we have villainized the procedure, but really we should be looking at the technique. And I think we have terrible techniques, and we're using terrible materials, and we're not using ozone, and we're not using red light, and we're not using lasers, and we're using toxic filling materials. So that being said, if you have existing root canals, I want them checked. And I don't want them just checked with a standard x-ray. I want 3D imaging.
Right.
Okay? Because many of them do have chronic infections.
Right.
And if you have a chronic infection, I do suggest you remove the tooth.
Okay.
Now, if it looks beautiful and you're thriving and you feel great, I think it is perfectly acceptable to monitor it.
Okay.
Again, it's the host. I think some people they don't do well with these procedures, and some do. And this is the train theory as well. Now, if you've been suggested to have a new root canal, I might persuade you to look into an implant instead. Okay. With children, it's a little bit different because you do something called a vital pulpotomy. You actually keep the tooth alive.
Okay.
So it's sort of like a partial root canal. So I do those in my office, but I use laser and I use ozone and I use bioceramics. It's important for children, I think, to keep their teeth for nutrition, for mastication, for digestion. The one thing that that's missing from the root canal conversation is you do have a periodontal ligament that does sometimes stay vital in the root canal tooth, and proprioception and biting is very important for brain health. So I'd like patients to try to save teeth.
Of course.
But with it, we have to look at risks and benefits.
Yeah.
So to me, my answer is convoluted because I think it's nuanced. I'm not going to come out and say every root canal is bad. I think there's a lot of room for improvement in the industry, and I do want you checking them because yours might be failing and it could be causing health issues.
Yeah.
And they're significant. I mean, there are links to cancer and autoimmune issues, et cetera.
Yeah. And I think in today's world, because it's toxic out there, we're plagued with challenges with the air, challenges with the water, and also that our food sources are greatly depleted, so they're not quite as nutritionally balanced as we thought they were, that we have to kind of consider supplements and filtering all these things out and paying a lot of attention to work with the right kinds of practitioners that actually know what they're doing and are considering meeting people at their level. Like what you just described was that. There used to be a thing that if it's not broken, don't fix it. So like here you have a whole bunch of people that have implants that are now thinking, wow, they did the right thing. And to your point, if it's not creating some kind of pathology, then maybe in fact, you should just be monitoring it. Yeah, I think that makes way sense.
Because implants aren't fail-proof. I mean, they fail, and people have reactions to them. They can break. I mean, nothing in the best dentistry is no dentistry, right? So nothing is perfect. But just being aware of it. And I think if you're fixated and you're worrying because someone on your social media feed has scared you, I worry more about what that's doing to your health.
And emotional and trauma and all that.
If you feel like something in your body is poisoning you, it's the placebo effect.
Yeah.
And I really believe in this. I mean, it could be doing damage to you in ways that it shouldn't be because of the way you're thinking about it.
Yeah, exactly.